Hey, this is Joel Topf for Nephrology Times. I'm here with Areef Ishani, lead author for the Diuretic Comparison Project. So we last hooked up 2 years ago when you were published in the New England Journal of Medicine with the Diuretic Comparison Project. Can you remind the viewers what that was?
Sure. It was a large, pragmatic, randomized controlled trial conducted at 72 VA medical centers and about 537 VA clinics, where we compared chlorthalidone versus hydrochlorothiazide on major adverse cardiovascular outcomes as well as non-cancer death. And the primary publication for that was there was no difference between chlorthalidone and hydrochlorothiazide. There was a little bit more hypokalemia in the chlorthalidone arm.
And hospitalizations for hypokalemia, right?
And hospitalizations for hypokalemia, correct.
But no AKI signal, and but you guys didn't look at renal outcomes.
We didn't. At that time we did not look at renal outcomes, but it was an a priori pre-specified analysis that we were going to do, which we're presenting today.
And that's where we're at now. Talk about what you guys found today.
Yeah, so for our secondary renal outcomes, what we were looking at was, again, chlorthalidone versus hydrochlorothiazide. The primary renal outcome, which we had defined in the protocol, was a doubling of serum creatinine, a terminal EGFR less than 15, or the need for a renal replacement therapy. And so when you look, so what we had to do is we had to require individuals to have a GFR prior to randomization as well as after randomization. And so the sample size is a little smaller. So our original sample size was 13,500-ish. We are about 91% of individuals met those criteria of having 2 GFRs at least.
And the people that had 2 GFRs, were they significantly different than the whole cohort?
They were exactly the same. They were just missing at random. In fact, the ones that were missing were a little healthier than the ones that were included, just because, again, nobody checked creatinine.
Makes sense, okay. And what did you guys find?
So again, on that primary renal outcome, there was no difference between chlorthalidone and hydrochlorothiazide. We also looked at additional outcomes, so a secondary composite outcome. Instead of a doubling of serum creatinine, we looked at a 40% reduction in EGFR, terminal EGFR less than 15, or kidney failure requiring renal replacement therapy. No difference. We also looked at incident CKD, so again, people without kidney disease at baseline. We had a high incidence of CKD, about 21% over the 3.9 years of study follow-up.
Okay.
But again, no difference between chlorthalidone and hydrochlorothiazide. We looked at total slope of EGFR, no difference between chlorthalidone and hydrochlorothiazide. We looked at AKI, no difference.
So previous publications had shown that chlorthalidone was harmful to the kidneys. It had increased CKD.
Yeah, so there were a couple of publications that were large insurance propensity matched models using claims data, and they both showed that chlorthalidone was associated with an increased risk of acute kidney injury and an increased risk of progression of kidney disease, and we were unable to replicate those findings. The two are about the same. Outside, again, we saw the same signal for hypokalemia. I think the thing that is a little different, we also subsetted the data, so in those with and without chronic kidney disease, to see if, maybe they're different. Yeah. No difference, again, in any of those outcomes. Although people without chronic kidney disease had a higher incidence of hypokalemia, including hospitalizations
without CKD, more
yeah, with chlorthalidone, okay. Correct.
So Agarwal in the CLIC study showed a remarkable effectiveness of chlorthalidone in people with deep CKD.
Right.
And I know in your first publication you just separated them based on GFR 60 above and below. Did you segment going lower than that?
We do. We have, again, the problem is we lose power. So of the 13,000 people in the study, if you look, it's about 3,000 have CKD at baseline, so again, that's a GFR less than 60. And then as you start going lower, the numbers really fall off. But again, no signal for difference between chlorthalidone and hydrochlorothiazide in any of those subsets, all the way down to a GFR of about 30.
Above 30 was as low as you got?
Above 30, yeah.
Okay. But you enrolled people below that. There was no exclusion?
There were no exclusion criteria.
Just not that many patients.
Again, it turns out most people who have CKD, their providers don't put them on a thiazide. Remember, you have to be on a thiazide to get into the study.
Specifically hydrochlorothiazide.
Correct.
25 or 50 milligrams.
Right.
Okay, so now you have 2 studies that show there's no difference between hydrochlorothiazide and chlorthalidone. Are you throwing away chlorthalidone? Have you just abandoned use of this medication?
So I like it, and the reason,
yeah.
The reason again, I like it because, as you do, it's got a long half-life, and I think that makes a difference. However, what I am open to, so before I was
I'm
not
just going to ask,
open.
what does it make a difference too if you've done the definitive work on this and there's nothing?
If I'm starting the drug and it's their first drug, I'll start chlorthalidone. However, before I would never consider dual agents, combination pills.
Yes.
Just because they all had
Hydrochlorothiazide.
hydrochlorothiazide. The only one that had chlorthalidone had atenolol, which I wasn't going to use anyway. And so now I'm much more open to using a combination. I think combinations are the way to go. It turns out my favorite combination is amlodipine benazepril, and then you can add thiazide on top of that.
Excellent, excellent. Any other final thoughts you have for today's study?
No, I think we have one more look at.
What's next?
So looking at stones. So so the no stone trial,
no
which I
stone
think you
trial.
guys just did on
Yeah,
NephJC,
yeah.
with an outstanding article that you
Yes.
guys then published. Looked at this, and we're going to look to see if there's a difference between chlorthalidone and
Feel the stone
hydrochlorothiazide
signal
on
there.
stones.
Excellent. Hey, thank you. This is delightful.
Great, thank you very much.
Very good.
All right.